Hello, I'm Dr. Aathira Ravindranath, Pediatric Gastroenterologist at Apollo BGS Hospital, Mysuru. Today I want to narrate an incident which we had come across at our hospital recently. A 1-year-old child had swallowed a very sharp nail a few hours back and he had come to us. So unfortunately, this nail had already passed the food pipe, the stomach, and had entered the initial part of the small intestine. So this child was only a year old and his weight was only 9 kilograms. We rushed this child into the endoscopy theatre, and we have state-of-the-art endoscopes which are thin and small for use in children who are less than 2 years old. So using this instrument and with the help of the anesthesia team and our endoscopy unit, we inserted it into the child's food pipe initially, then into the stomach, and then went deep into the initial part of the small intestine, which is the first part is called the duodenum, then the jejunum. So this nail was almost 5 centimeters long and it was lodged between the duodenum and the jejunum. And this was embedded within the mucosa of this duodenojejunal junction. So the task here was to remove this nail safely without injuring the mucosa, and also doing it quickly because we just had few minutes with us as the nail was passing ahead, which will be beyond the reach of the endoscope. So had this child come to us late or had we delayed the procedure, the nail would have passed beyond the jejunum and then it would have perforated, that has created a hole in the small intestine, which would necessitate surgery. And that will be an entirely different complicated process because he will be at risk of infection after the perforation of the intestine. So we went in with the scope, and with the help of our endoscopy team, we could hold the 5 centimeter long nail and we held it at the sharp edge so that it does not injure the rest of the intestine, and we slowly took it out, and the procedure was over in about half an hour's time. After the procedure, we observed the child for about an hour and he regained consciousness and we were able to send him home. Please do not delay. I know that these are difficult times and patients are finding it very difficult to come to hospital. Even if they come, they are actually anxious about getting care because of the prevailing situation of COVID-19. But this is the prime example to teach us that a stitch in time saves 9. Because the child came to us on time and we had all the whole team assembled and we had the instruments to actually do endoscopy in small children, and we could do it on time and save the child. So the message that I want to convey is that please do not delay in case a child swallows a foreign body, and please rush the kid to the hospital at the earliest, because we are hearing incidents where kids are losing lives because of unattended foreign body injections and care could not be given at the right time. So please rush, do not worry about COVID. We are taking all precautions to protect your child. Your safety is our priority. Thank you.